and I'm gonna let you guys go on this journey with me. But I did want to come in and talk to you guys, let you guys know that I am fine and I'm doing all right. I did post something on my Facebook and my Instagram a couple days ago, which I did decide to kind of take down, just because I kept it up in my support group. I did post it in my support group, which I can try to link that in the description below as well. But however, I did keep it up on in my support group post, but I just didn't want it up on my personal pages anymore. I kept it. What's up, guys? It's your girl Kayla, and I am back with another video. It's been long overdue, but I plan to just do my makeup and talk to you guys about my experience with PCOS. First of all, I want to explain what PCOS is exactly. Okay, so let me just give you guys a rundown of what PCOS is. It stands for polycystic ovary syndrome. It usually happens, basically you notice it when there are abnormal menstrual periods. You're usually obese or overweight. You have some type of infertility issues, acne, depression, or any type of mood disorders, loss of hair or unwanted hair in certain places, like your face or things of that sort. Some of the related conditions that I looked up were, of course, obesity, endometriosis, having fibroids, ovarian cysts, having miscarriages, and mood disorders. As far as what the actual definition of it is, so it's basically a hormonal disorder that is common among women. Sorry guys, if you see me looking back and forth, I have no cards that I wrote down this information from, and I will tell you where I got my sources from as well. That way you guys can go look it up, and I'll link it below as well. Polycystic ovary syndrome is basically a hormonal disorder that is common among women. The ovaries, they may develop numerous small collections of fluid and fail to regularly release eggs. The exact cause of PCOS is uncertain due to like research and different things like that. But early diagnosis, treatment, and weight loss can reduce long-term complications such as diabetes and heart disease. Some of the causes from what I saw with my research is excess insulin, low-grade inflammation, meaning if your cells become resistant to the action of insulin, and it can also be hereditary as well. There is an ugly side to PCOS, what I like to call the ugly side. I'm of course going to be transparent with you guys as possible, so I'm going to put it in my own language. But so the ugly side to PCOS would be an elevated level of male hormones such as facial hair, acne, and male pattern baldness, which was something that I actually experienced. Not necessarily the baldness, thank God, but as far as like me losing hair and stuff like that, I did experience some things like that. As far as getting facial hair and things of that sort, I did not really get a lot of facial hair. As you can see, I do have some acne, but I don't have a lot of excessive facial hair. So that was one of the things that happened to me, was just losing my hair, having mood disorders such as anxiety, and just experiencing irregular periods. So when is it good to see a doctor. When should you go see a doctor? I suggest going to see a doctor when you notice any type of abnormality about your body. But doing my research, it says when you have any concerns about your periods, any infertility issues, acne, or any other symptoms that I mentioned earlier in the video, if they continue to worsen, that's when they do suggest online for you to go see a doctor. But these are just a few symptoms and a few things that I didn't want to touch on base while I'm doing my makeup. But I wanted to give you guys a full disclaimer. I am not a doctor. I don't have any type of licensing or certifications in this area. So you do want to do your own research as well as going to the doctor for yourself to figure out what's going on with your body. But I did want to inform you guys because this is something that is not talked about as much within not only just the community of women, but the community of African American women as well. I'm noticing that it's more common. It's a more common thing, and a lot of women are struggling with it, but they're not as open to speaking or discussing on this topic. So that is why I'm here to do a little chit chat and talk to you guys, and also you guys can see how I do my makeup. So we'll just do a little chit chat. Hopefully the video is not too long, but I did want to give you guys a rundown of everything prior to me getting into my look. So I'm just going to start off by priming my face. And I'm also going to discuss, you know, certain things that I did experience or I have experienced so far while going through the PCOS experience. So far, the first thing that I noticed was that I was having irregular periods. So what did I do? I went to the doctor to figure out what the heck is going on with my body. I did go in with the Smashbox Photo Finish Primer. So I'm gonna kind of go out of order. I'm not going in any particular order on my face. I'm just doing what I typically do to kind of get ready for the day. So yeah, I experienced irregular periods. So that was the first clue that I was just kind of like, you know, it was just kind of weird to me because I've always, ever since I've been like sexually active, I have always had regular periods, never had any issues with that. And so here as of recently, I've been having irregular cycles, and that was something that did cause me to go to the doctor and figure out what exactly is going on. And I'm not doing this in any particular order, but I'm gonna go in with the Juvia's Place. It's kind of dirty, but it's from the makeup. I don't know how it gets everywhere, but it does. So I'm gonna go in with the Juvia's Place foundation. That way I can kind of get it on my face. And I know a lot of people do their eyebrows and stuff first, but hold on. First of all, let me peel these back because y'all, I'm trying to do my makeup and my hair is gonna be in the way. Okay, so I'm putting the foundation on my face. Do I use foundation every day? No. Do I do my makeup every day? Absolutely not. But for the sake of this video, I am going to be doing my makeup because that's something that makes me feel good. And that's one thing I noticed going through the PCOS situation. If y'all see me do that a lot, I'm trying to keep my AirPod in. But you know, that's the one thing I will say is to try to stay encouraged and, you know, try to stay around people that support you. I did join a support group with other women who do battle with PCOS. And it has been really helpful to kind of see the different women who are similar to me going through something such as this. So, but yeah, I started off having irregular periods. And then from there, I went to the doctor. They started giving me blood work, different blood tests that needed to be done. Now I'm about to go in with my concealer. I'm using e.l.f. Hydrating Camo Concealer with a satin finish. And this is in the color medium beige. This is just the color that I like to use for my face in particular. And I'll just apply it directly on to my face. This is kind of like an updated little makeup routine too, because I haven't done a makeup routine in a while. But yeah, it's gonna be kind of quick too, so hopefully it comes out good. But yeah, so y'all, finding out that I had PCOS, I ain't gonna lie, it really took me back. I found out in the beginning of the year. I was really taken back from it because of the fact that I have never had anything or thought I had anything wrong with trying to conceive a child or anything wrong with my ovaries. So this was a first. I am going to spray my face with a little bit of setting spray, and this was also e.l.f., but I've had it for so long that it literally just faded in the front. So there's that. Like I said, I'm doing this out of order. This is not in any particular order, but I don't want to use that. I'm not telling y'all my brushes either because literally I have a whole bunch of random brushes in a mason jar. But yeah, so here as of lately too, I have not been filling in my eyebrows because my eyebrows are pretty full already. As long as my eyebrows are cleaned and they look good naturally, I'll just kind of go around them in concealer and just do it like that. I don't darken them, I don't fill them in. For the sake of the video though, I'm going to try to at least fill them in. But so yeah, y'all, had irregular periods, so then I decided to go to the doctor. And that's one thing I can say, my boyfriend has been so supportive of this whole journey, very supportive of this journey. And that's one thing I'm really grateful, of, because he didn't have to come with me to doctor's visits. He didn't have to, go through this experience with me, but it's the fact that he really cares enough to do that, And that's the one thing that is just so solid to me, but yeah, I'm not even gonna try, I'm literally not gonna even do that. I'm gonna put some of this eyebrow setter, whatever you want to call it. I'm gonna put that on my eyebrows because I can't find my spoolie. So this actually has a spoolie on it, and it sets your eyebrows. You're supposed to put it on after you put the stuff on your eyebrows, but I tried to put something on my eyebrows. Got a little dark, but it's not really doing what it needs to do, so. But yeah, so went to the doctor. They did some blood work, checked my hormone levels, and just made sure that everything was okay. So at first they were thinking that it was endometriosis, which, I had been in contact with a couple people who had endometriosis. Hold on. I'm gonna do my eyebrows off camera and then I will come back. I know I look crazy, y'all, but it's a process to this madness, for sure. Okay, so concealed my eyebrows, and now I'm literally about to go in and just blend everything I'm going to be using a Real Techniques brush, and this is in the number 200. Let me spray my face one more time. Okay. So basically, I went to the doctor, I got some blood work done, and they basically told me that it could possibly be endometriosis. Neither one of them was fine with me. They told me it could either be PCOS or they told me it could be endometriosis. Neither one of them was fine with me. Like, I didn't want to have either one of them. But having endometriosis to me versus having PCOS was, you know, I don't know. It was, to me, I was thinking that it was better in a way. Like, not better, but just one better than the other, basically. But, you know, it just is what it is. Sometimes you can't help how the cards lay in your life. And this is just a journey that God is taking me on to make me stronger. And that's how I look at it. And I got diagnosed with PCOS a couple weeks ago. And I have my first appointment with the fertility doctor on Friday, which is tomorrow. And I'm actually looking forward to it so I can kind of, you know, figure out what the heck is going on and how can I figure out how to handle this or cope with the PCOS. You know, if they're going to give me some methods and ways to either lessen the symptoms, because it's non-curable as of right now. It is non-curable. So, you know, I need methods and ways to be able to lessen my symptoms. And that is basically what I am doing by going to the fertility doctor or specialist. Okay, so if y'all hear the noise in the background, I do stay in an apartment, so we have neighbors who have dogs. My boyfriend is actually in the front room. He's listening to the news, so please excuse all that noise. But I just went in and I blended my face in from my under eye to my eyebrows to my foundation. Now I'm about to go in and do my contour, which is going to be done with one of my makeup brushes that I need to find. But so yeah, y'all, I basically went to the doctor and found out I had to go get some ultrasounds done. So, cause my blood work, it was so weird because they were thinking it was endometriosis because my blood work came back normal. And so they were like, okay, well, maybe, you know, you got endometriosis. But come to find out, it wasn't endometriosis, it was PCOS. And, you know, how I would say it's been affecting me. I started having mood disorders back in 2020. I probably had it, I probably dealt with mood disorders my whole life, but I was diagnosed back in 2020. And, you know, I kind of spazzed out on my family. It was a whole bunch of stuff that was going on. Y'all, I'm trying not to cuss. But it was a whole bunch of stuff that was going on. And it basically caused me to get diagnosed with anxiety. And I actually take medication for it and everything now too, which is actually a really good thing too for me in particular, because when I'm not on my medication, y'all, it's a whole different Kayla. But because I finally got that under control, like, I know you need to take your medicine, you need to be, you know, on point with your health. I've been trying to make a few different lifestyle changes, things of that sort. So, you know, I've just been doing what needs to be done as far as taking care of my body and making sure that I don't have to continue to deal with something like this. So I have been on a workout journey with my boyfriend. We've been going to the gym. This is day 2. I didn't go to the gym today. I just did an at-home workout, which is fine with me because they hit different. You know what I mean? You doing an at-home workout and you got the heat on 70 in the house and you sweating, baby, it's going to do something. It's going to do something. But yeah, so basically when I got the ultrasounds done, and my ultrasound came back abnormal. So what happened was they ended up finding a large ovarian cyst on my ovaries, which turned out to be like 5 centimeters big, which is like in comparison to the size of a lime. So y'all know I was freaking out. I was freaking the heck out. Like, I didn't know what to expect. You know what I mean? I'm just trying to blend this out as much as I can, y'all. This is not gonna be perfect by any shape or form. Like, y'all probably looking like, this girl, if she do her makeup like this every day, it's a mess. But it's gonna turn out good, y'all. But yeah, so I basically, you know, I was just like, oh my gosh, wow, there's a cyst on my ovary. I've never had a cyst in my whole 24 years of living. I've never had a cyst. And so I was thinking it was the end of the world when, come to find out, cysts are actually very common in women. And a lot of women have experienced having cysts. And in my case, I went back for a follow-up ultrasound. It was about 6 weeks before I went back, and boom, the cyst was gone. So it had evaporated on its own, and I guess it just went away. And you know, I'm thanking God for that. But they did find that my ovaries had like little fibroid-like cells, not necessarily cysts, but if you look up a picture of what PCOS ovarian cysts look like, they're like little follicles on the cyst, and that was basically what my cysts looked like. And so that's how they determined that I had PCOS. And so basically once I was diagnosed with the PCOS, I immediately went into research mode, and I started to look up different ways to, you know, figure this thing out without having to take medication, because I was seeing that they put people who have severe PCOS on metformin. I do not want to be on metformin. Metformin is for diabetic patients, and I do not have diabetes. So, you know, and then I was talking to other people who had taken metformin before, and they were saying that it gave them nerve pain and all sorts of stuff. I'm putting blush on now, y'all. Hopefully I can take me a little makeup class so I can get better with my makeup and doing other people's makeup as well. I don't want to be a makeup artist, but I just want to know how to do makeup better, because I do makeup on myself so much. But yeah, so basically, once I found out that I had the PCOS, I was just in research mode trying to figure out what I can do. So I went and I got me some supplements. I got me some teas. I've been working out, trying to change my diet to a more like vegetable type of diet with a few meats incorporated, like fish, chicken, which, you know, chicken is not too out of the norm, but more so on the fish side as well, and more so on the vegetable side as well. So I've just been trying to change my diet, and I'm gonna let you guys go on this journey with me. But I did want to come in and talk to you guys, let you guys know that I am fine and I'm doing all right. I did post something on my Facebook and my Instagram a couple days ago, which I did decide to kind of take down, just because I kept it up in my support group. I did post it in my support group, which I can try to link that in the description below as well. But however, I did keep it up on in my support group post, but I just didn't want it up on my personal pages anymore. I kept it up for like 2 or 3 days, and you know, I just got to a point where it's like, I don't want people knowing me for having PCOS. Like, I'm going to beat this. I'm literally going to beat this. And I don't want, you know, I was getting a lot of positive feedback and support, but at the same time, hold on, let me put my my lip liner on. At the same time, y'all, I'm happy-go-lucky Kayla. And sometimes we're not always strong. But during this process, y'all, I have been super strong. And I noticed myself starting to kind of feel bad for myself. And I'm like, absolutely not. Absolutely not, you know? So, if y'all see, I'm slipping in my little lip combo for y'all on the slick. I'm just using the NYX, what is this? Lasting Finish Lip Liner. And this is in the color Mata Labra 790 Brownie Pie. Y'all ain't gonna be able to see that, but that's the lip liner I use. And then this right here, this is from Beauty Spot Store. It's my go-to, period. It's my go-to. And this is also by NYX. And this is in the color Satin Ribbon. So if y'all like that lip combo. And then I do a touch of the Lip Plumping Gloss by e.l.f. And this is also like a light pink type of color that I do. And this is in the color Pink Cosmo. I don't know if you're gonna be able to see that. You have it. Like, I have PCOS. I'm dealing with it. I'm trying to stay encouraged. I want you guys to stay encouraged. If you have any questions, please feel free to comment below or send me any personal messages if you have my social medias. They will be linked in the description below as well. But this is just the intro to a lifelong journey that I'm going to be dealing with. But now I'm about to try to fix up my hair and give you guys the finished look of everything. So hope you like this video, and I just want you guys to stay encouraged. Oh, let me put that on. Y'all, I'm trying to end the video. I didn't put no type of setting spray on. This is why you literally have to have some type of plan. But let me just go back in with this really quick. Oh, you know what? I'm gonna use that brush. I got my beauty blenders. So, but yeah, let me put this. I'm just gonna pat this in just a little under my eye. This is the Airspun loose face powder that I got from, I believe I got this from Dollar General. They sell this at Dollar General now, y'all. But they also sell it at like Walmart, Target, you know. I don't know if they sell it at Ulta. I think this is more of like, yeah, because Ulta has a drugstore section as well. So they probably sell it at Ulta as well. I've never looked for it at Ulta. But yeah, I'm just gonna dab that in. Put that on. And I need to do, give me just one moment. Okay. Let me get my lashes put on off camera and I'm gonna come back. Okay guys, so this is the finished look. So I just got on this wig that I cut into a bob. I got this wig a while back from a local girl. Her name is The Neat Freak, and she has some wonderful hair, and I've had this hair for over like 2 years now. And I made it into a bob wig, and I really like it. But this is the final look, guys. So like I said, I was just coming to you guys and just telling you about my experience with PCOS. Like I said, please go seek a doctor if you do feel like you might have PCOS or you have symptoms of PCOS. I am not certified, I'm not licensed, I'm not a doctor. I'm just someone here to tell my personal story and share my journey with you guys. So like I said, this is the final look. I'm so happy and excited with it. It was really quick, nothing like too constructive or anything that I feel like other people cannot do or aren't capable of doing. This is a look that can totally be done by beginners. But yeah, so I hope you guys enjoyed my video. Like I said, if you have any questions, please don't hesitate to message me or comment below. Please like, share, comment, and subscribe. And hit the notification bell to be notified whenever I post a new video. And thank you for tuning in. I love you guys so much. And without further ado, I will see you all later. Bye, my forever babes.